Today we are celebrating the World Diabetes Day, 14th of November every year and globally. We all know that diabetes is a global epidemic, not only in the Gulf and UAE, but all over the world. And all the healthcare providers, the society should work together to prevent the development of diabetes and also prevent the complication. This year, the theme for the World Diabetes Day is breaking the barriers and bridge the gap. There is many advancement in the diabetic care for the last few years. New medication and new technology which change the quality of life of our people with diabetes. Nowadays, the diagnosis is so easy, the patient came with the diagnosis. Our role as care provider is to provide the best care for our patient, not only to control his blood sugar, but to keep his kidney healthy, as well as to prevent him from the future complication of diabetes, the both microvascular and macrovascular complication. The trend shift now from just looking on the blood sugar. We are not aiming to drop the HbA1c only, but we need to evaluate our patient from the first day for the presence of chronic kidney disease, for the presence of established cardiovascular disease, or if he is very high risk for the cardiovascular disease. Because with this, we are mandated to give him the medication which show in evidence-based data to protect his kidney and prevent him from further cardiovascular event, regardless of his diabetic status and the HbA1c. So now we are looking that on the patient globally, not looking only on the sugar. We should look on his blood pressure to achieve the target of a blood pressure 130/80, and on his lipid parameters, which should be dropped significantly, because most of our patients with diabetes are either high risk or very high risk. In addition, advice for the lifestyle, the exercise, maintaining the weight, and stop smoking. Weight is coming as a priority with the presence of a new medication which help control the blood sugar, and with the positive impact on the kidney and the heart, is also promoting weight loss. So we should utilize those medication when the facility available, and we don't have the insurance cover with this to help the patient achieve the target as well as losing weight. Any weight loss will have a positive impact in diabetic control, and also will have significant impact in preventing the patient with a pre-diabetes to progress to diabetes. Diabetes technology will become also another innovation, and new generation now you are using the self-monitoring of a blood glucose instead of the traditional, pricking, and checking for the blood sugar. And also, this will help us to see the day-to-day control of blood sugar. The fasting, the postprandial, how many hypo, how many hyper, and this will be impacted in a better glycemic control, and also less complication, better quality of life. So we should change our thinking, just looking every 3 or 6 months on the HbA1c, to looking on the daily variability in the blood glucose, what we call the time in range, that what is the time of the patient during the day is in diabetic control, which should be not less than 70-75%, with minimal hypoglycemia, probably less than 1% for severe hypoglycemia. So the future is open, with the much newer medication coming, more technology, more patient awareness, more educational activity, that all should engage in supporting our patient, with the society support, with the organization, as well as which is help the patient to live with diabetes as safely as possible, with a better quality of life. So I think this is a day which we should celebrate to make a patient with diabetes life more bright and more optimistic, and to live as long as possible without complication. We are here always to support our patient through our educational institute, the Gulf Medical University, which bring every year hundreds of qualified doctors to serve our patient, as well as our healthcare system in Thumbay Care, which have long relation with thousands of patients with diabetes during the last 25 years. Thank you.